Good morning. This video we are going to discuss about the functions of hypothalamus. This is the continuation video of the hypothalamic nuclei and their connections. Functions of hypothalamus is important question for MBBS students and paramedical students. This is asked as the 5 marks short notes. So all of you should know about this topic. First important function, body temperature regulation. Hypothalamus acts as a thermostat in our body to maintain a constant body temperature. Thermostat is a device that detects the temperature to maintain the body temperature is called as the thermostat. So in our body, the hypothalamus is act as the thermostat. So when the body temperature is increases, when we are going to the hot climate, anterior hypothalamus is stimulated to produce the heat loss. So anterior hypothalamus is concerned with heat loss. So when we are going to the cold climate, cold place like Ooty, so that time the posterior hypothalamus is stimulated, it produces a more heat production. Okay, so posterior hypothalamus is concerned with the heat production. So in the fever, so normal temperature is 98.4 degree Fahrenheit around. So 98 to 99 the range. So that is set in the hypothalamus. That is altered in the fever. So it is temperature is elevated. Normally it is maintained within the normal range. So during the fever the thermostat set point is changed. Second important functions of hypothalamus is the endocrine function. So hypothalamus connected with the anterior pituitary through the hypothalamo-hypophyseal vessel. The blood vessels, type of portal vessels connect the hypothalamus to the anterior pituitary. Hypothalamus releases the hormones or factors that control the release of anterior pituitary hormones. Example like growth hormone releasing hormone and growth hormone inhibitory hormone are somatostatin, thyrotrophin releasing hormone, corticotrophin releasing hormone, gonadotrophin releasing hormone, prolactin inhibiting hormone or somatostatin. These are released from the hypothalamus that control the secretion of the anterior pituitary hormones. This diagram depicts the connections between the hypothalamus and anterior pituitary, posterior pituitary. Hypothalamus connected with the anterior pituitary through the hypothalamo-hypophyseal vessel. Hypothalamus connected with the posterior pituitary through the hypothalamo-hypophyseal tract, that is the neurons. Okay. So anterior pituitary connected with the hypothalamus. So arcuate nucleus releases the hormones, releasing an inhibitory hormone that stimulate the anterior pituitary, releases the hormones. Preoptic nucleus stimulate the releases the gonadotrophin releasing hormone and gonadotrophin inhibiting hormone that act on the anterior pituitary, releases the follicular stimulating hormone and luteinizing hormone. Arcuate nucleus releases the gonadotrophin releasing hormone, gonadotrophin inhibiting hormone or somatostatin that act on the anterior pituitary, releases the growth hormone. Hypothalamus releases the corticotrophin releasing hormone or corticotropin inhibiting hormone or somatostatin that act on the anterior pituitary, releases the adrenocorticotrophic hormone ACTH. And hypothalamus releases the prolactin releasing hormone or prolactin inhibitory hormone or somatostatin. Act on the anterior pituitary releases the prolactin. And hypothalamus releases the thyrotrophic releasing hormone or thyrotropin inhibitory hormone. Act on the anterior pituitary releases the TSH, thyroid stimulating hormone. And posterior pituitary connected with the hypothalamus is by a hypothalamo-hypophyseal tract. So here the hormones, supraoptic paraventricular nucleus, secrete the ADH. This is the different. Secrete the ADH oxytocin from the supraoptic and paraventricular nucleus, that is released and stored in the posterior pituitary. Whenever the hormone is needed, that is released from the posterior pituitary into the circulation. The last diagram itself I explain these points. Posterior pituitary releases the antidiuretic hormone oxytocin, that the ADH and oxytocin secreted by the supraoptic paraventricular nuclei of hypothalamus, transported by the hypothalamo-hypophyseal tract into the posterior pituitary lobe, where it is stored and released whenever it is needed. Third important functions of hypothalamus is the control of circadian rhythm. Circadian rhythm is a physiological process occur in our body regularly in the cycle of 24 hours. Okay. So example like ACTH, growth hormone, these are secreted mainly during night time, in the early morning. Okay. So it is occur regularly every day. The growth hormone more produced during the sleep and the sleep wakefulness cycle. So every day we are sleeping at night, wake up at the early morning. And body temperature rhythm. So in the early morning temperature is lesser than the evening temperature. And gonadotropin secretion, everything is occur in the pattern of circadian rhythm, cyclical pattern. So that is controlled by the suprachiasmatic nucleus of hypothalamus. That is act as the biological clock. That is act as the biological clock. Okay. So that is connected by the retinohypothalamic fibers. So retinohypothalamic fibers is important for the sleep wakefulness cycles. Okay. The melatonin produced from the pineal body, that is also play certain role in the sleep wakefulness cycle. Another important function of hypothalamus is the control of food intake. It is controlled by the two center, feeding center. It is located in the lateral hypothalamus. Satiety center is located in the ventromedial nucleus of hypothalamus. The feeding center is stimulated when we are feeling the hungry. Okay. So when we are feeling the hungry, we eat the food. So when we eat the food, the glucose level is increased. That will reach us the satiety center. Satiety means satisfactory center. So that reaches the ventromedian nucleus through the insulin receptors. So from the ventromedian nucleus, send the impulse, inhibitory impulse to the lateral hypothalamus. So it sends the impulse to stop the feeding. Like this, it sends the impulse. It is normally occur. Okay. In the diabetes patient, what happened? The insulin receptors are defective. Okay. The patient eat the food, already the glucose level is elevated, but the glucose does not reach the ventromedian nucleus. So the lateral hypothalamus does not inhibit, always stimulated position. So he always eat the food. That is called as the hyperphagia. So the lesions of the hypothalamus, ventromedian hypothalamic nucleus also produces the excessivity. That produces the obesity. That is called as the hypothalamic obesity. So how the food intake is regulated? That is some hypothesis. Hypothesis means some concepts. First concept is lipostatic hypothesis. Lipostatic limit. How the limit is helpful to reduce the food intake. So the limit, adipose tissue produces a hormone like leptin. Leptin means thin. Okay. So the leptin main function is inhibit the food intake. So leptin act on the hypothalamus to decrease the food intake and increases the energy output. Then this is the lipostatic hypothesis. So nowadays that keto diet peoples, they are eating always the fat and protein content. That will decreases the food intake through this concept. So cut peptide hypothesis. Okay. So the gastrointestinal tract releases the polypeptides, that is GI hormones, cholecystokinin, glucagon, gastrin related peptide, which act on the hypothalamus to inhibit the food intake. This is the one concept, gut peptide hypothesis. Next one is the glucostatic hypothesis. Increased glucose utilization in the hypothalamus produces the sensation of satiety. It is the glucose is enter into the ventromedian hypothalamus. It is inhibit the feeding. Next, thermostatic hypothesis. Fall in the body temperature below the set point stimulate the appetite. In the cool climate, we eat more food. So that is the fall in body temperature below the set point stimulate the appetite, and rise above the set point inhibit the appetite. So during the hot environment, we mostly eat the less amount of the food. This flow chart depicts the role of hypothalamus in the food intake. So here alba melanocyte stimulating hormone, cocaine, amphetamine regulated transcript, and these substances inhibit the food intake through the ventromedian nucleus. Here the ghrelin, that is GI hormone, that stimulate the feeding center. Leptin and insulin inhibit the feeding center. Okay. So corticotropin releasing hormone also inhibit the food intake by stimulating the satiety center. Okay. And leptin, insulin inhibit the feeding center, lateral hypothalamus nucleus. The lesions of the ventromedian nucleus produces the obesity. Lesions of the lateral hypothalamic nucleus produces the anorexia nervosa. So patient does not eat anything. Okay. So they will lose the weight. Orexin is the substance released from the hypothalamus that stimulates the appetite. So it stimulates the hungry. And already I told the lipostatic hypothesis. Fat storage releases the leptin that inhibit the lateral hypothalamic nucleus, and glucose, increased glucose act on the ventromedian hypothalamic nucleus that stimulate the satiety center, and stretching of the stomach releases the vagus and ghrelin. The ghrelin stimulate the food intake, and vagus also play the important role in the food intake. Regulation of water balance of the body is another important function of hypothalamus. It is controlled by the supraoptic nucleus of the hypothalamus. It has the osmoreceptor. So increase in plasma osmolarity stimulates the osmoreceptors. When the water level in the body decreases, the plasma osmolarity increases. So that stimulates the antidiuretic hormone secreted from the supraoptic nucleus that increases the water reabsorption from the renal tubules. So the reverse happen when the fall in the plasma osmolarity inhibit the osmoreceptors and inhibit the ADH secretion. This decreases the renal reabsorption of the water and restore the water balance. Third center is located in the lateral hypothalamus. Increase in the ECF osmolarity stimulate the lateral hypothalamus that promotes the water drinking. Control of autonomic nervous system is the next function of the hypothalamus. Lateral nuclei of hypothalamus control the sympathetic nervous system. Anterior nuclei of hypothalamus control the parasympathetic nervous system. Stimulation of the mid-dorsal area of the hypothalamus causes the cholinergic sympathetic vasodilatation, mainly in the piloerector muscles and skin, that produces the sympathetic vasodilatation. Mainly sympathetic stimulation produces the vasoconstriction. This place only it produces the vasodilatation. Stimulation of the dorsomedial nuclei and posterior hypothalamic area produces the increased adrenal medullary secretion that catecholamines levels are increased, that produces the sympathetic stimulation. Next function of the hypothalamus is the control of sexual functions. Hypothalamus releases the gonadotrophin releasing hormone that is important for the influence the onset of puberty and secretion of the gonadotrophin, FSH and LH, that influences the sexual behavior, and stimulation of the anterior and posterior nuclei also produces the sexual drive. That posterior pituitary releases the oxytocin, that is also play the important role in the sexual functions. The gonadotrophin hormone releases the testosterone, that is also play the important role in the sexual activities. Control of emotions is the next hypothalamic function. Stimulation of the lateral hypothalamus increases the anger and rage. Rage means intense anger, that is Tamil சொல்றாங்க வெறித்தனம்ன்றது மாதிரி, that is rage, that is due to the lateral hypothalamus. Stimulation of the ventromedial nucleus result in plasticity. Plasticity means they will not respond for any stimuli. எவ்வளவு அடிச்சாலும் தாங்கறான்னு சொல்றாங்கல, அதான் plasticity. என்னதான் ஸ்டிமுலேட் பண்ணா அவன் ரெஸ்பாண்டே பண்ண மாட்டாப்ல, ரொம்ப கூலா இருப்பாங்க, that is plasticity. Reward centers located in the stimulation of the lateral and ventromedial nuclei of the hypothalamus. So that produces the happiness, produces the sensation of the reward and satisfaction, happiness. And punishment center, the stimulation of the periventricular nuclei and the periaqueductal nuclei that produces the unpleasant sensation like fear, pain, terror, defense escape reactions and other element of punishment. Okay, so the negative thoughts will come due to the stimulation of the periventricular nuclei of the hypothalamus. Influences on sleep. Sleep center located in the posterior hypothalamus. Suprachiasmatic nucleus of the hypothalamus produce the rhythmic pattern of the sleep and wakefulness. The relation to stress, during the stress, corticotrophin releasing hormone is released by the hypothalamus, which causes the release of adrenocorticotrophin hormone from the anterior pituitary. ACTase releases glucocorticoids from the adrenal cortex to tackle the stressful condition. Summary of the today video is that hypothalamus is important for the temperature regulation, endocrine functions and circadian rhythm pattern, and it controls the food intake, regulation of the water balance and autonomic nervous system, control of the sexual function and emotions, sleep and stress. Okay, so the functions of hypothalamus is the important question, most important question for the MBBS students. It may ask us the 5-mark question. It is also important for the paramedical nursing students. So இந்த வீடியோ உங்களுக்கு பிடிச்சிருந்தா லைக் பண்ணுங்க, உங்க ஃப்ரெண்ட்ஸுக்கு ஷேர் பண்ணுங்க. Thank you for the watching this video. Thank you.